Gyms and some light contact sports have now been given the green light to reopen. But could this result in more cases of coronavirus here in the Buckeye State? Dr. James Voos is the chairman of orthopedics and sports medicine at University Hospitals, and he joins us now with some insight. Doctor, good morning.
Good morning. Thank you.
You were on the governor's task force to reopen sports. With that in mind, what factors did you consider when it came to opening up sports?
Yes, first I'd like to commend our public health officials. They've done a remarkable job in considering all of the items and safety guidelines that go into decisions like this. And this task force was made up of public health officials, owners and coaches from youth sports leagues across the state of Ohio. So a lot of incredible input that we were proud to be a part of. And first and foremost is the safety of our children. And we all want to see our kids get back to sports. We know the positive physical and mental and social benefits of sports, but first and foremost is, can we do this safely? And then how can we execute this with clear guidelines that both the parents and players and the coaches can follow?
All right, non-contact sports, we're talking baseball, tennis, and the light golf can resume with some restrictions. Talk about the restrictions that are in place.
The primary restrictions, and this falls both again on the coach and on the parents, is first to make sure if you're going to show up to practice or participate in these activities that you're not feeling ill, that you've taken your temperature at home, so that knowing that you're safe to be out in public. The other parts are to maintain that appropriate distancing, to bring your own water bottle so we're not sharing those water jugs and water bottles like we used to in the past. And then appropriate guidelines as to how to sanitize the sports equipment, whether it's helmets or the balls between innings, or in tennis where each player would use their own set of tennis balls. So those type of items provide some practical distance while still allowing the sport to occur.
Doctor, gyms, fitness centers, dance studios now reopen. When we go back to those places, what are they going to look like?
Yeah, we recently published a study in the journal Sports Health talking exactly about this, how to keep athletic training facilities very safe, and specifically in the gyms. And we know that there's a lot of everybody's sweaty and there's high throughput through those locations. So very important that both the gym owners and the dance facility owners maintain those clear and frequent hygiene policies. And then the patrons that attend, those that are working out at the gym, also participate in cleaning the equipment in between. If you are somebody who may need to wear a mask or protect yourself from that standpoint, separating the equipment a little bit further, those type of things allow you to get there and everyone to enjoy themselves and have those benefits of a positive workout while protecting their other patrons.
Final question, Doctor. You work with the Cleveland Browns. With that in mind, will we see football this fall?
Yeah, we sure would like to see football resume here in the fall, and the NFL and the players are working very hard on a plan to assure that football can occur safely. Clearly, we want to follow all of our state and federal public health guidelines, but I know that's the plan. Everybody is working very diligently to make this happen in as safe a fashion as possible.
All right, Dr. James Voos from University Hospitals, thank you very much for your information this morning.
Thank you. I appreciate it.
All right.